Good evening, everyone, and thank you for joining us. My name is Mackenzie, and I am the Community and Provider Education Coordinator for NAMI Maryland. I will be the moderator for our webinar this evening. During times of high stress, it is important to be cognizant of your personal mental health and that of your family members. Tonight, we are hosting a special guest, Bette Stewart, who will introduce you to a support plan, which can be used to help you and your family members identify and address relapse symptoms before a mental health emergency occurs. I want to begin our webinar by introducing our speaker. Bette Stewart is a consultant and trainer for the University of Maryland Evidence-Based Practice Center, where she works with public behavioral health provider agencies to deliver evidence-based assertive community treatment and family psychoeducation. As a longtime NAMI member, Ms. Stewart has led and coordinated NAMI support groups, as well as NAMI's evidence-based practice program, Family to Family. Ms. Stewart is a national and state family-to-family teacher, trainer, past executive director of NAMI Maryland, and was one of the first advocates for insurance parity in Maryland. Thank you for joining us, Bette. Before we get started, I wanted to note just a few housekeeping points. To avoid background noise, all participants will be muted for the duration of the webinar. We will be addressing questions at the end of the webinar. If you have any questions as the webinar continues, please enter them into the questions box. This is located at the right-hand side of your screen if you're viewing from a computer, or at the bottom of your screen if you're viewing from a phone. We will be reviewing questions as they come in, and if something in particular is unclear or needs to be expanded, please let us know and I will ask Bette to do so when the question is asked. During the webinar, Bette will be asking questions to better help us learn a little bit more about you, as well as to meet your needs. We ask that you please engage with us and type your answers to these questions in the questions box. If you have any comments or concerns during the webinar, please enter these into the questions box as well. Myself and my colleague Jamia will review and address any immediate needs as they occur. The recording of this webinar will be emailed to each registrant tomorrow evening. The recording will also be available on our website at www.namimd.org for any individuals that were unable to register this evening. Continuing education credits are not available for tonight's webinar. A certificate of attendance will, however, be sent to each registered participant tomorrow evening. After the webinar tonight, you will be asked to complete a short survey on the aspects of this webinar that you felt were helpful, could be improved, and what you would like to see in future webinars. This is only one webinar in a series of educational webinars that we plan to host. We ask that you please fill out this survey to let us know how NAMI Maryland can best support you during this time. Now let's get started with our speaker, Bette Stewart.
Thank you, Mackenzie, for your kind introduction. I really appreciate it. And I'd like to thank NAMI Maryland for inviting me to speak about planning ahead for a possible mental health emergency. And thank you to the audience for joining me this evening. I hope everyone is able to stay healthy and managing as best you can under these unusual circumstances. So this has been a difficult time for most of us, where our routines have been disrupted. We're not able to visit face-to-face with our friends, neighbors, coworkers, and other family members. And many of us are not able to work at all. Some are able to telework while others are working so that the rest of us can have our essential needs met. I'm still figuring out how to master the different platforms used for presenting webinars, and I hope you'll bear with me if I happen to press the wrong button. So before I get started, I wanted to say the first thing that's the most important thing, and that is that safety is the most important factor in handling any kind of mental health emergency. And you will see, okay, safety above all else. So what I have on this screen is a list of crisis numbers and for crisis response teams and a hotline. And also at the very top is the 211 number, the Maryland helpline, which I just learned about. And again, you can contact the Maryland helpline by calling 211, and they are available 24/7, 365, and they're available to callers in need of any kind of crisis intervention, risk assessment for suicide, or overdose prevention, support, guidance, and information or linkage to other community behavioral health providers. They will actually send your call to a crisis management team in your community. So this information is available on the NAMI website. You'll see that located at the bottom of this slide. And it's a very, very useful website. I went onto it and was actually surprised at how easy it was to get information I was looking for. So I want to introduce you to the agenda, the things that we'll be talking about tonight. And the thing I wanted to talk about was how to support someone before the situation arises where symptoms become intense and get out of control and become a crisis. Because I know as a family member of someone with mental illness, when the crisis happens, the first knee-jerk response is to, call 911 or to get the person to an emergency room for help. And I think that with planning in place, we can hopefully eliminate or at least minimize some of the trips to the hospital. It's as important for the person experiencing the illness to recognize early warning signs as it is for those people who are around them. Sometimes it's easy to overlook the emerging symptoms, but tonight we'll talk about the importance of identifying them as soon as possible. Once we know what we're seeing, we can plan for an agreeable way to help manage these symptoms before they become more disruptive to the person experiencing them and to their support system. Families and natural supports are terms that I'm using loosely to mean anyone with whom an individual has a close and trusting relationship. That could include their family of origin, parents, siblings, grandparents, etc., as well as close friends, significant others, roommates, co-workers, and anyone else that they feel really comfortable with. I have to say that often family members are the carers of last resort, especially if an individual has been ill for a long time and may be disconnected from their previous supports. Families can be a valuable resource for supporting someone experiencing symptoms of mental illness. I hope this webinar will show how families can be helpful in minimizing thought and behavioral symptoms of illness before they become a crisis. So now I have something on my screen. Okay, so let's see. Okay, see, I pushed the wrong button, but I'm getting there. I think I'll. Well, maybe. There we go. So planning for an emergency. So I was thinking about this. Yes?
Betty, just press from current slide at the very top.
Okay.
There you go.
Okay, is that it? Okay, perfect. Sorry.
No worries. We're all learning.
Ahead of time. This is all new for me. Okay. So planning for an emergency. I mean, I think we all plan for snowstorms and blizzards, and we know exactly what to do the first moment that a meteorologist comes on and says, oh, we're going to have snow, no matter what the forecast is. We're prepared. We know what we need to do. We run out, we get the bread, we get the milk, and of course, the all-American standard toilet paper. We're prepared for this. We know what to do the minute we have an inkling that it's going to snow. Same thing about earthquakes. If you live in an area where there are earthquakes, you know that the thing to do is to, well, I forgot what you do. Let's see. You know, you stop, drop, and hold on to things in an earthquake. But if you live in an area like California, you would be aware of these things and you're prepared and you know what to do. Same thing with tornadoes. Head for the basement. Growing up, I mean, and even now, places that I work, there's always a fire drill. And it's not that anyone expects there to be a fire. It's just that we plan for that. We plan to, if for any kind of emergency that might be, you know, around the corner. So let me just see where I am. When I remember, of course, I'm at the age where I grew up in the 50s, and we used to do air raids. And, you know, even though as an adult, I look back and I say, well, that was kind of a silly planning thing, but because if there was an atom bomb that was dropped, putting our hands over our faces and leaning up against a locker wasn't going to save us. But there was a plan in place, it kept order, and people knew what to do and how to handle it. So we were caught off guard, I believe, with COVID-19 when it came. It's changed our day-to-day operations. You know, we no longer have the routine that we were keeping before. Sometimes, you know, we are not working, or we can't work, or we have to work from home. But again, we weren't planned for this. And I think that that's one of the reasons why stores are out of flour and yeast and toilet paper and all this stuff, because people ran out and grabbed what they thought they would need for this time of being secluded in our houses. We need to have a plan, and I think that universally that there is going to be a plan that's delivered for when we have to face a crisis like COVID. The same thing can happen in preparing for a mental illness crisis, and that is to be able to identify early warning signs before things get out of hand. So one of the things that's really important is in planning for an emergency is to learn as much as you can about mental illnesses. The more you know, the better you can be prepared to handle them. At the bottom of the page, for those of you who can see, the NAMI Maryland education support groups are a great place to get lots of information about every kind of mental illness you could imagine. The website, the NAMI website, which is on another slide that I have coming up, is a great place to get information. So that being said, we learning as much as we can about mental illnesses is important, but it's also important to be able to identify things that might be brewing and coming up, and that could bubble into something more serious than just some symptoms that are showing through. So here we have all the things that we've planned for and some of the things we haven't planned for. And now what we're going to talk about is planning for behavioral changes that are taking place with our family member. Okay. So let's go to the next slide. So in the beginning, I talked about a crisis, and I wanted to define what crisis is. A crisis basically includes, but is not limited to, suicidal or homicidal thinking and or behavior, a rapid onset of psychotic symptoms, sudden changes in mental status, and violence. So that's the definition of a crisis. We're trying to avoid getting to that point, and that's the purpose of this presentation this evening. As you can see on the slide, I have identified a wonderful brochure that NAMI has, What to Do in a Psychiatric Crisis in Maryland. Very helpful, very useful. You can find that on their website, which is www.namimaryland.org/crisis_help. Lots of information. What are early warning signs? Oh, actually, for crisis plans, many, I would say most clinicians use crisis plans for individuals who are at risk of harming themselves or other. And as Mackenzie said in the beginning, I do work in the public mental health field. And yes, people mostly have safety plans, crisis plans for people who have a history of thinking about suicide or homicide, things like that, a plan in place to intervene. I think, and I work with my teams and encourage them, that everybody should have a plan in place. You don't have to be, you know, thinking of hurting yourself or someone else. I mean, symptoms of mental illness can pop up, and it's always good to be prepared for that when it does happen. So early warning signs, what are they? They're the changes in the moods and the thoughts and or behaviors that are seen before a crisis. So every situation is unique as it is individual. Not everybody's situation is the same. Not everybody's symptoms are the same. And the success of planning for an early intervention to prevent a crisis depends on being able to identify these symptoms, but also it requires collaboration. And that collaboration is with the person who has those symptoms. It's also with, you know, family members or natural supports or anyone who's working with that person. This is something that can benefit everyone. The most important thing is to start that conversation with the person who has a mental illness so that you can plan ahead in case things start to be noticeable, that things are headed in the wrong direction, and starting to develop that plan. So again, just keep in mind that the purpose of the plan is to help the individuals and the family, actually the individuals regain control before it becomes a crisis, but the family or the natural supports can really support that and help that. So identifying early warning signs. So early warning signs may appear days or weeks before a psychiatric crisis. It helps when individuals and their trusted supports can identify those signs before they become full-blown. It's not uncommon for people close to the individual to observe early warning signs first. I remember one of the pieces of research that it's pretty old now, but it was that families pick up on early warning signs, you know, much sooner than other people, simply because they know the family member, because they know they've experienced symptoms before, and they can pick up on things pretty quickly. I know when my husband was having an exacerbation of his symptoms, he always started out by having a little twitch in his cheek. And, you know, it was an insignificant kind of thing, but to me, it always meant that within the week, there would be a crisis and he would wind up in the hospital. So when I started seeing that little twitch in his cheek, I paid attention to other things, and we were able to, most times, we were able to prevent a trip to the hospital. And we know that preventing the trips to the hospital is really important because it is a very traumatic experience for anyone who's had to be taken to the hospital and for anyone who's had to watch someone be taken to the hospital. And of course, we would just love to not have to go through that again. So again, important to know the warning signs, but here's the caveat. Sometimes people who have rapid cycling might become psychotic very quickly, or the symptoms might get out of hand very quickly. So again, you can be as prepared as possible, but sometimes it will slip past you, and that's okay, because, you know, again, you know how to handle a crisis. You can call 911, you can call 211, person can call their therapist or whoever it is that's working with them. There is a booklet that I referred to on the NAMI website, Navigating a Mental Health Crisis. You can find that on the website. Excellent book. Actually, it's not a book, it's a brochure. So I'm wondering, number one, how many people here on the call have a plan in place? Does anyone have a plan? And put that in your chat box, either yes or no. Do you have a plan for when you first see the symptoms beginning and a way to manage that? I'll just give you about 10 seconds, just a yes or a no, if you have a plan. Okay. Mackenzie, do we have anybody who has a plan?
We do. We have quite a few people that do have a plan in place, but the majority are saying that no, they don't have anything currently.
Okay, well, good. Well, hopefully by the end of tonight, you'll at least be thinking about this. So again, we talked about the early warning signs. I'm wondering, I told you a little bit about my husband, and I'm wondering if you have picked up on early warning signs, either early warning signs that you've experienced or early warning signs of a friend or a family member of yours. If you have, could you just type in like a 1 word or 2 words of something that you might have noticed that was an early warning sign? Anything that comes to mind that you've picked up on? Okay, do we have anyone submitting anything or?
We do. So we have a few different people saying a decrease in energy or inability to sleep.
Okay,
Voice becoming louder, feeling more angry. Also have overactivity where they can't sit still or rapid speed and decrease in motivation.
good. Okay, good. So I also have a list of things up here. These are possible early warning signs. And again, your family member or if you're experiencing this, you will know what some of the signs, early warning signs are. Again, it's true. Changing in sleep patterns, changing in your eating habits, hygiene, substance use, sometimes stopping seeing their providers, their psychiatrists or their social workers, whomever, increased agitation and irritability. These are all possible early warning signs. So if we know what the early warning signs are, we can be aware of it. But what are some of the stressors, do you think, that could bring on the early warning signs? And again, using your chat box, if you think that you have some idea of something that might have stimulated the symptoms to emerge. And if you could just write that in the chat box, we will look at that and see what people have to say. Because again, stressors are different for everybody. Sometimes some of the things that are good things can also be stressors. So anything popping up that's notable, Mackenzie?
We have just the COVID-19 has been a stressor for people.
Yes, yes, and I think the thing to keep in mind about the COVID-19 is that's a stressor for everybody, not just someone who has a mental illness or, I mean, this has just turned everybody's lives upside down and forced us to do things we've not done in the past, and to learn new ways of doing things. And I think in a way it's a lot like having a mental illness. You've got to learn other ways of managing things and handling things, and you may not be able to do the things the same way you did them before. And I think it's the same thing with COVID. We're not going to get back to where we were before, but we're learning how to do different things, and different isn't always bad. So unless you're old and rigid like me, and it's hard. But so some of the possible stressors are things that most of us would think are pretty positive. So graduating and knowing that other people are moving on, or your sibling is graduating and you had always wanted to graduate, but you did not manage to graduate from college because of an illness. Someone getting married, someone getting divorced, the birth of a baby, not necessarily your own, but just someone else's baby, can all be stressful to a person who, who has an illness, a mental health illness. Of course, death. Even going on a vacation can be stressful. I know trying to get ready to go away on a vacation is always stressful. It's just a relief to get home once I've gone on a vacation, because it's just getting everything organized and together. And these are the kinds of things that can really be stressors for people. And you're right, COVID can really be a stressor for people. So what do I suggest? Just keep calm and trust yourself. A lot of times we second guess what's going on, and we say, oh, well, that's not really an early warning sign, or I don't really want to be, nitpicky or keeping an eye on things. But again, just trust your gut reaction when you think you're seeing early warning signs. So when's the best time to begin planning? Well, the best time to plan is before there's a crisis. You can really not count on getting anything constructive done when there's a crisis or an emergency. So again, timing is really important. You want to wait until everyone is calm, speaking to each other, things are okay, and it's approachable, and you can have a conversation about how can we prevent this from happening in the future? What are some things that we might be able to do? Again, it just depends on who initiates the discussion, but someone has to initiate it and then engage in that discussion. You're using your observations. You're also taking some of the stressors that you might know about, and you're using them in a way of saying, okay, so this is a stressful situation. There's a good chance that maybe this could be something that would be, an additional stress to the person. So I'm going to keep my eyes open just to see if I see anything else going on. Again, working together, that is the key. It's not going to work if you're over there as a family member and you are writing down what you notice as a warning sign, and your family member or the person who has an illness is not interested in participating. Maybe it's not the right time. Maybe it's a time you need to wait for another time that's calm, and a time when you can approach it where it's not seen as maybe intrusive. Working together to identify the things that you notice before a crisis. And again, and allowing the person who's experienced it to talk about it. And again, and I say, offering thoughts after asking permission. And I know I'm guilty of that, of saying, trying to give my 2 cents worth, and not listening as much as just trying to contribute. And I know that doesn't work. And just, saying, well, would it be okay if I offer this thought? I mean, one of the things that I notice before you're getting sick is that you're staying up all night long, and and it's just something I've noticed. And does that seem to be something that you notice too? Having a conversation and not a one-sided conversation. I put this slide in here, the pros and the cons, because again, there are some benefits to having a plan, and then there's some reasons why it might not be easy to do. So some people may find it very comfortable, especially in a time of confusion. When I was teaching family to family, I had a family member whose son was very, very ill and in crisis a lot of the time. And after coming to the family class, she said, I feel so much more comfortable. She said, I have a plan in place. I know exactly what I do if I start to see early warning signs. And I said, well, I'm so glad to hear that. How's it working? And she said, oh, it hasn't worked for me yet, but I feel better. So again, whatever works for you. Some people might think one of the cons to that is that people might feel that it's too intrusive, or it's too difficult to think of a crisis that could happen again. So being prepared in the event moods, thoughts, or behaviors change, and to have an action plan if needed. Again, that's one of the pros. Everyone involved in the process has a clear understanding of why a plan is helpful. That can be a pro and a con. You know, sometimes it's helpful to have for everybody to be on the same page, and sometimes it might feel when a person is getting experiencing their illness more, they may feel that it's intrusive. One of the cons of having a plan is for the person who is sick, the fear of being involuntarily hospitalized. If I start verbalizing that I'm not feeling well, or I start acknowledging that the early warning signs, then my family is going to flip out, and you know, immediately I'll be dragged to the hospital. So sometimes having a plan in place might be frightening to someone. Another pro is it minimizes the risk for hospitalization, which I think is a really good thing. One of the cons is someone might feel that the plan puts another person in charge of their well-being. Hopefully with a support plan like this, we're giving the responsibility to the person who has the illness, because again, they're the ones who have to endure it, and they're the ones who, you know, need to take some charge and control of what's going on with them. And the pro, of course, is it gives the control back to them. We're not telling them, you need this, you need that, do this, do that. We're going by what they're saying. And again, there's always that chance that someone will say, I'm not interested in doing this. I'm not going to do it. So again, you know, it's not the perfect answer, but I think it's something that can help people. Okay, so what is the plan? So it's integrating individual preferences. It's what does the person who has the illness, what do they want to do? And so developing the plan is really based on what is going to be something that the individual feels comfortable doing. So things to remember about plans, they're brief. They don't need to be long and exaggerated and everything else. They need to be fleshed out to a point, but they don't need to be terribly complex. They need to be in an easy to read format. We recommend 1 page. Needs to be in the person's own words. You know I'm feeling, I know I'm experiencing early warning signs when I'm unable to go to sleep at night, or I feel I identify one of the early warning signs as not wanting to get out of bed in the morning. When you make the plan, everybody who's participating in the plan should have a copy of it. And that copy should be available so that in a crisis or leading up to a crisis, you know where it is and you know what to do. It's important to write down the steps of the plan, because in an emergency, it's easy to forget the steps. And I put that in there because I work with a lot of providers, and I see a lot of plans in people's charts. And what I find is sometimes they're not completely filled out. And I say, so what happens when there's a crisis and you're trying to help this person? You don't have the phone number, you don't have the name of the person. And, you know, I mean, again, we think we know these things and we'll remember these things. But the reality is, when that time comes, it's really hard to remember. Recognizing the warning signs that may lead to an impending emergency, we need to identify them. And then the internal coping strategies without sharing that information. So when a person is experiencing early warning signs, they don't need to broadcast it and tell people. It's very empowering for them to take the responsibility. There might be things they can do. You know, socializing with families, or they could, you know, it could be something that's a distraction, something that they like to do. I'm going to ask if anybody here, since some of you have gotten plans, have you identified any of the internal coping strategies that a person can do when they start to feel symptoms coming on? If you could put that in the chat box, that would be great. Okay, do we have any responses, Mackenzie?
We have relying on others in our family as a coping strategy to kind of get that support. And then we also Someone had mentioned that they like to be by themselves. So kind of
Uh-huh.
the ends of the spectrum.
Right, exactly. I mean, sometimes people like to take a walk, or sometimes they like to watch TV or listen to music, or reading a book may not be, I mean, but some people might do that. When I get really stressed, I like to focus on really complicated crossword puzzles or things like that. I mean, it's just whatever works for the person. And that way the person can identify the symptoms are coming and they know exactly what they can do to sort of get past the feelings that they might be having, a distraction. So again, socializing with families is another way. It doesn't mean you have to come to the family and say, hey, I'm beginning to feel really anxious, blah, blah, blah. Let's, I need to talk to you. Instead, taking control and just saying, hey, it's great to see you guys, and just spending time with family. But knowing who and how to contact people, but also knowing who to contact for professional help if things escalate pretty quickly, okay? So you want to make sure that in your plan you have a provider's name and a phone number, contact information. You have a number for a crisis response team or an ACT team if the person's a client of an ACT team. You want to know what the 211 number is. You want to know about 911 and for the crisis intervention team. And you want to make sure that you ask when you call 911 for a trained officer to come who's trained, a CIT officer to work with the client. But always, if it's a life-threatening situation, you always want to call 911. Using internal coping strategies. So again, these are the things the person can do on their own. Distractions, identifying any roadblocks to using these strategies. Is there a reason that might get in your way that you wouldn't do this? And the easiest strategies are prioritized to the top of the list. These are the things you're going to go to first. This is something that I learned a while back, and that is, once you're writing these plans, it's really important when someone puts an answer in there to ask the question, how likely do you think you would be to follow through with this during a time of crisis? Many times people just put down names or phone numbers, or a name, no phone number, and you want to make sure, is this really the person you want to contact? If there's a crisis or you're feeling really out of sorts, will you call this person? Using socialization to distract and obtain support. What are some of the things that get in the way, and how can we overcome them? And again, the person adds to the list. It's their recommendations. It's the people that they feel comfortable with. Remembering to use the plan. Again, if things get a little more heated up, it might go to the next level, which is, okay, so I can go to my family or my natural supports and I can say, look, I'm feeling really edgy. Things are, I'm not thinking clearly, or I'm not feeling right. Let's just, let's talk about this. But it's letting the person take the lead on that. Again, asking, how comfortable would you be going to someone? Let's pick someone that you feel really comfortable going to. I might think it would be, my mom, but in fact, it could be somebody else that they'd feel more comfortable with. Finding out who it is and how they will follow through with it. You want to have a fallback person. You want somebody to be there in case the first person is not available. The other thing to keep in mind is it's really important to communicate with anybody who's included in the plan to make sure that they agree to do this. They need to know that if they get a call at 3 o'clock in the morning from Joe, it's not because Joe just wants to bug them. It might be because Joe's really feeling stressed or feeling really out of sorts, and you're one of the people that he'll be reaching out to. So it's good to let people know that. And again, how likely do you think you would be in a time of crisis to call this person? Part of your plan should include a list of professional contacts with their phone numbers. If your therapist is not available, is there an on-call number? Is there someone else that you can call? Is, looking at a 24-hour hotline. And again, are you likely to call those people? It's always good to ask that question. And I think for the most part, people are pretty honest about that. One of the things you always need to keep in mind when developing any kind of plan is to think about suicide or any kind of lethal means that a person has access to. Does the person have access to any kind of firearms? Are there other means that the person might use to harm themselves or someone else? You want to make sure that if you start to notice specific behaviors, that there's part of the plan where you know that you need to make sure that those firearms are locked up, or that all of the medications, in the house are in a safe place where the person can't get to them if they're if they're feeling suicidal. Just being aware of what's going on. That's the most important thing. So when and how to implement the plan? You implement the plan when you start noticing changes. And again, your first thing that you would do is, if you're a natural supporter or family member, you would ask the person, how are you feeling? I'm concerned because I've seen a couple of things that you've identified as early warning signs, and I'm just checking in to make sure that you're doing okay. And asking them, have you noticed anything yourself? And they might say no. And I think at that point, you need to really be patient. And a lot of times, and again, as a family member, I've been very guilty of saying, well, I see this and I see that, and that does not help the situation. You want to let the person, for the most part, be making, the calls. It's a call of judgment. And I think that, people who have an illness really, if they understand the early warning signs, that they're not desirous of going into a hospital. And I certainly don't think they want to have the police called. So I think that for the most part, people are pretty open about this, and it's not extremely complicated. Keep the plan where you can find it. You can have the best plan in the world, but if you can't lay your hands on it, or you don't remember where you put it, or you don't remember what's in it, which during a time of symptom exacerbation, it might be really, really difficult to remember things. You want to make sure that you can get your hands on that plan. And again, I can't say it enough. Write it down. If you don't write it down, it's easy to forget things. Okay. And then the most important thing after that is to update as things change. Are there additional things that you might notice? Or is there something that you did that didn't work? Again, revising the plan, it's a constant, constantly reevaluating situations and being willing to make changes. I mean, it's pretty straightforward, but if you don't know about planning and you haven't really thought about it, this is a time to think about it, especially with all of the other extra stressors that are going on nowadays. It might be even more important to have a plan in place. So I think, again, just some basic things. Don't wait for the crisis to start writing a plan. Remember your tone of voice. My husband used to say to me all the time, oh, Betty, your voice is so irritating. It's just the way you say it, and it causes me to be more agitated and anxious. So be cautious, of your tone of voice. You want to lower the stress level in the house, because it's easier to speak when you're not agitated yourself. And it's really difficult to listen when you're arguing. Again, reminding you to ask the person how they're feeling. Don't just assume that because you've identified something that they're also seeing it. There's a delicate balance between being hypervigilant and knowing the early warning signs. You know the early warning signs, but that doesn't mean you spend your entire day looking for those early warning signs. And I think sometimes that's sort of, if you don't have a plan in place, it might be easy to be hypervigilant and be looking for those little things, those triggers that remind you that it might be, the beginning of an impending crisis. nobody wants this to become, escalated and a trip to the hospital. So anytime you can have a plan in place, it's much better. And I found this lovely quote. I'm not big on quoting people, but I found a quote from John F. Kennedy. The Chinese used 2 brush strokes to write the word crisis. One brush stroke stands for danger, the other for opportunity. In a crisis, be aware of the danger, but recognize the opportunity. So I hope that you will, those of you who don't have a plan in place will consider it. Those of you who do have a plan in place, I think this is amazingly wonderful. And now I'm open to any kind of questions or comments that you might have. Please put them in the chat box and Mackenzie will share them with me.
Thank you, Betty, for providing this critical information on how to plan ahead to avert a mental health emergency. We truly appreciate your time that you came out tonight. We would like to open up the webinar now for any questions that you may have. Remember that each participant will stay muted to avoid background noise, but we want to hear from you. So if you can type your question in the question box, and this is at the right-hand side of your screen if you're viewing from a computer, or at the bottom of your screen if you're viewing from a phone.
One of the things I omitted was that on the NAMI website, there is a template for developing a plan. So you don't even have to start from scratch. You can just go right onto the website, download the template, and work on in collaboration with the person who has the illness, with the family, even with providers, if you have consent to speak to providers. It's very easy. It's there online. I mean, they couldn't have made it any easier. So do you see any questions popping up?
We have one question so far. And again, if you have any questions, please do let us know. The question is, sometimes I have a plan in place, but it doesn't always work when I'm getting manic. Do you have any suggestions on how to improve upon that plan when something doesn't work?
Well, again, that's why, have a backup. Don't just have one possibility. Come up with several things that might work to try. And again, as I said earlier, sometimes it doesn't work. I think it's better to be prepared, and I mean, that is a really, really difficult question, and not having, manic episodes, but having experienced them through my husband, I know sometimes they can come very quickly, and you can go from early warning signs to having a full-blown manic episode pretty darn quickly. And so, yes, in a case like that, plans may not work. And again, some people may start to see the early warning signs, and taking a walk, reading a book, watching TV isn't going to help them. They might need to go to a more intensive intervention. I wish I could give you a better answer, but again, it's just trial and error for many of us. Anything else?
So we don't have too many questions, but we do have one comment I just wanted to share with you. Pam wrote, "This is wonderful information. Thank you so much for sharing this with us."
Well, thank you. I appreciate that.
So if nobody else has any more questions, I just want to thank you all for joining us tonight. We do hope that this information through the webinar has been helpful for you this evening. And please remember that the webinar has been recorded and will be emailed to every registrant tomorrow evening. The webinar will also be uploaded to our website at www.namind.org. for any individuals who were unable to attend tonight and may find the information helpful. We wish you all a safe and healthy rest of your week, and please do not hesitate to reach out to us through our website, or you can call us on our warm line at 410-884-8691 should you need any additional resources or support. Thank you so much, and good night, everyone.
Thank you, audience, and thank you, Mackenzie.
Thank you, Betty. Good night.